Well, I've two stories I can just short ones that I can add on to having worked independently as a nurse practitioner and in the Arctic and different things. So I worked for a brief period at the Canmore Hospital. So I think I was on alone this night. The other person hadn't shown up, but this 28-year-old woman came in. So I took her temperature and examined her, and she had abdominal pain and on and on. So I thought, well, I'll save the doctor time. So old Dr. Milton's was a real character. You'd have to know this, and definitely an old school. So I phoned him and I said, oh, Dr. Milton's, we have this 28-year-old lady, and gave her history and presenting with this abdominal pain, and on examination she's tenderness and blah, blah, blah. He said to me, huh, you want to be the doctor? You be the doctor, and hung up. So I had to send this woman to Banff. He wouldn't come and see her. Oh, yeah. So anyway, that was a lesson that, you know, there is a fine line between being a nurse.
Better with animals than people.
Yeah, yeah. And when I first came to Canmore, they hadn't had a permanent public health nurse before, so there was no real programs. There was little bits and pieces had gone on. Someone came out from Calgary. Anyway, I wanted to set up prenatal because I thought this was really important. So I called the doctor in Banff and I said, could I come to the doctor's meeting on whatever day they had it? And he says, oh, no, you can't come. And I said, why not? He says, well, you're a nurse. And I said, well, I just want to talk to you about prenatal, and so you can all have your input into what you'd like me to teach and whatever. And he says, oh, you can't come. And I said, well, why not? He says, well, we have lunch. I said, I don't want lunch. I just want to come and talk to you about prenatal. Anyway, I went there and said, do you have anything to input? Oh, no, they had no idea what I'd be teaching at prenatal. So anyway, that was the beginning of the prenatal classes. But I included them. They had to come and talk to the parents. So they were part of that process. But it's an interesting learning curve in smaller areas when they've never had things like that going on.
So did you see that, like in terms of the relationship between doctors and nurses, did you see that change over time?
Oh, tremendously, tremendously. Yeah, I went after I started here in November of 74. And it was either that fall or in the spring, there was a workshop in Calgary, a 2-day workshop by this Dr. Deacon, who was a neonatologist. And he was a very progressive sort of guy. And I was so interested in what he was teaching that I thought we would really benefit in this area from his teaching. So I invited him out, and I don't know if that had ever happened before. And so he came out, and he came to a staff meeting in Banff, and I was so nervous that day. I got the doctors' names all mixed up. But anyway, he said, for 2 years, I've been waiting to get into this area to meet everybody, and it took the public health nurse to do that. Anyway, by the time the women that were in the Banff hospital having their babies came home, they were saying to me, Dr. Deacon says. And I said, well, how did you know what he said? Well, because that's all the nurses could talk about was what Dr. Deacon said. So it was a whole change. The fathers were allowed in the delivery room, and the whole process changed. And it was interesting to see parenting and how people parented change too. So it was pretty exciting to be there in the beginning.